Hello, I'm Jawad. I'm the Exec Medical Director at East Lancashire NHS Hospital Trust. In keeping with my previous updates, it's reassuring that the numbers of COVID admissions to the hospital is reducing significantly. As of today, we have only 5 patients with COVID in hospital, one of the patients being in intensive care. The numbers in community are somewhat fluctuating in the transmission. I'll run through some numbers as I have always done to give you an idea. In Blackburn with Darwin, we have 38 per 100,000 people who are positive after the test. Burnley 22, Hindburn 60. Now this has been an increase in the last few weeks, hence that element of variation and fluctuation in community transmission. Pendle is 34. Ribble Valley has the lowest transmission of 11 per 100,000. Rossendale 15, making a total of 32 per 100,000 within our conurbation. As you would see from these figures, there is still a significant need of us following the rules in the face, space, hand hygiene and social distancing. We still are not out of the wood because there are various models which are predicting an increase in the COVID transmission and hospital admissions probably late summer, early autumn. The more we do to follow the rules, the better it will be for our communities. On a note of good news, as you would have heard that in the Northwest there have been more than 5 million vaccinations now, and we are part of it. We have done very well in the sense of vaccination, both with hospital hubs and our mass vaccination sites. It is also important to know that the government has now expanded the cohort of people who can have vaccine. So from today, the age group 42 and onwards are encouraged to come forward for the vaccination. Last week, it was announced that all pregnant ladies should have COVID vaccination, and obviously in consultation with their medical practitioners, they should come forward and have their vaccines. In keeping with the reduction in the restrictions, we are going to gently ease visiting to the hospital. You should be able to have a look on our website to see which wards are allowing visitation. There is also ease on visiting at the maternity units, and for scans, please do check with the unit before you come to hospital for that. Attendances in A&E and urgent care centres have been gradually increasing, and as I have mentioned in the past, please utilise all the resource available in the community before you decide to come to the hospital. GP services are providing appointments. 111 is another source. Your local pharmacies are also able to help. We are open for business, but it is important that you attend the hospital for the right reason. Finally, I would just like to remind all that all East Lancs Hospital sites are smoke-free sites. Please respect this by not smoking on site. By doing so, you will be helping our patients and our staff and yourself. And once again, please look after yourself and your loved ones by following all the rules and regulation that NHS England, local government and Public Health England has put in place. Bye for now.